Good morning. What's your name?
Pat Alderman.
And what were the symptoms you had when you first came into the office?
I had the searing pain in the side of my calf and also a great deal of kind of a throbbing pain in my hip.
And how long had that been going on?
I had been experiencing that for about a week.
Okay. And what types of things were you doing to try to remedy the situation?
Well, having no idea what was wrong, I was living on about 12 Advil a day, which was just taking the edge off of the pain without actually eliminating it.
And taxing your kidneys and liver, no doubt,
I'm
as
sure.
well. So when you came in here, what did we find out that you had wrong with you?
Well, you suspected initially that it was a herniated disc, had an MRI proving that it was, and it was fairly significant, at least by my estimation, 8 to 10 centimeter tear, which you said was a pretty hefty tear.
Mm-hmm. And then what types of treatments did we do, and what type of results did you receive?
Here there was an adjustment each day. There was the oxygen therapy with the wheel, the hand wheel, and then there was this weighted pull, this decompression table.
Yeah, and how happy were you to get the results that you did, and where are you at today?
Today there's no pain at all. There's not even any residual, really. There's nothing. It's all done. We went through a process where I came 3 times a week for about 6 weeks, I think, and went through that protocol plus some exercises that you gave me. Within the first 2 weeks, it was lessening a bit. I wasn't on quite as much Advil and Tylenol. About midway through, there was a significant change in not needing anywhere near that amount of medication, and it just gradually got better and better and better. At one point there, right toward the end, I think I left you a phone message that felt like I was living in a miracle, literally, because this is a type of thing that I wanted to feel really positive about this approach and see my glass as half full instead of half empty, but it's very frightening to consider that I may be facing the prospect of surgery. So this was just absolutely incredible to me that it was such a clear progression in a positive way of lessening pain. First, that pain went out of the hip, which was outstanding to get rid of that throbbing pain that was constant, and then that searing pain in the leg just gradually got less and less and less and less. So I was at least able to go to the grocery store without having to stand there on one leg like a pelican. It was outstanding,
Wonderful.
Absolutely outstanding.
And so anybody that you would know with any type of sciatic type symptoms or bulging or herniated disc, what would you suggest they do?
Well, I would recommend them here if they happen to be living in Atlanta. If they're not, and in fact I had this experience over the weekend with a friend in Phoenix who was visiting, and she's had this as a reoccurring problem, and I explained the therapeutic protocol that you put me through and suggested she find someone out there rather than just being tanked up on this Tylenol and Advil.
So you ready to get back on the tennis courts now?
Indeed.